You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Deb would like to know if it's okay to take all of the supplements together or if we should take separate ones at different times.
That's a good question. If you saw me take our supplements, for most of them, I take them all at the same time, and handfuls of them. My wife and daughter are amazed how many I can swallow at one time. But yeah, so it really depends on, again, some like a digestive enzyme, for example, should be taken a few minutes before a meal. And some people don't do well taking, for example, DHA without food in their stomach. So sometimes you might have to separate them or spread them out. But for the most part, yeah, most of them could be taken at the same time. Probiotics as well. I know, Dad, you like people to take them, like you say, down the hatch first thing in the morning. I've heard you say that a few times. But yeah, I wouldn't worry about that. I don't know if you have anything different to say than that.
No, I mean, it's whatever you're used to. I mean, some like your vitamin D, for example, is a fat-soluble vitamin. So it's not the end of the world if you take it on an empty stomach. But I like peanut butter because it gives me an excuse, first of all, to eat peanut butter. And second of all, it's fat, mostly fat. So it absorbs my vitamin D even better. But I do it by convenience because I found myself having supplements in my pocket with a great intention of taking them at lunchtime or whatever. And guess what? The next day, they're in my pocket again, just because I forget. So for me, I take all my supplements at once. Now, I know thousands of patients over the years that were taking, for example, magnesium or some cortisol to help them sleep at night. And so they put that supplement right beside their bed or whatever, and they have it, they have it at that time. So, hey, whatever, like magnesium, again, I like taking, I often do take it at night just before bed if I feel like I'm overtired or whatever, or got a muscle spasms or stuff like that. That helps. And for people with cortisol at night, keep some, you might divide the dose.
Yeah.
And a lot of patients take it because they're used to taking pills, take it at different times. You can take your supplements at the same time.
Yeah. So as a rule of thumb, no, for the most part, it doesn't matter. Mm-hmm. All right, Brandy, what's up next?
How do you treat severe anemia?
Well, first things first is anemia is a symptom of something. It's not a diagnosis, right? So when you hear somebody say, I got anemia, anemia is an effect. You always have to know what the cause of anemia is. And there are a few bigger causes of anemia, anything from not getting enough iron in their diet, poor digestion, especially if they got any kind of digestive disorder at all. They're just not going to be able to metabolize iron properly. So there are a lot of reasons for that. So if somebody has severe anemia, you definitely want to be taking an iron supplement. We have a liquid one that we like that's easy to absorb. We call it Blood Boost because we used to tell people your blood needs a boost. So it was a very lazy naming system that we used for that one. But it's something you can get into your system that can bypass a little bit of the digestive issues, go from there. But then you got to figure out what's causing that severe anemia. Is there an ulcer? Is there bleeding? Is it digestion? Is it, so there's different reasons for that, but definitely start taking an iron for sure. Take digestive enzymes because as a rule of thumb, there's always a digestive issue going on as well. And I would take probiotics also. Anything else you want to add, Dad?
Yeah, well, one of the things, and I mentioned this morning because we were talking about B12. And one of the things that B12 does, they always think of B12 as, of course, it helps with oxygen. And B12 helps with the production of red blood cells. So with anemia, that's often the case, right? A lot of times with anemia, you know, doctors sort of get hooked on ferritin, and I understand that. They want to check your iron levels, but I you know, and even Tony, you were mentioning blood boost, but blood boost, the reason, yeah, we were lazy maybe when we called it that, but it's got so many, blood has a lot of cofactors. Like there's a lot of things is going into making blood. Your spleen and bone marrow make blood, but you need B12 to be optimized. You know, you want your heme iron, right?
Yeah.
Which is really important. So, you know, but there's a lot of reasons, like you say, you got to get to the bottom of why anemia. And then just another thing that I was saying this morning, just to repeat, is that if, you know, a lot of people don't know they're anemic because their blood work is, you know, maybe it's a little bit borderline, but I would tell people, look at your skin. I mean, people would come into the office and I even see little kids, pale as, they look like Casper the ghost.
Yeah, they look like vampires.
Yeah, you know, and I go, like, it's not makeup you need.
Yeah.
It's iron and B12, right? Like you got to get your blood up.
Now,
and a lot of people didn't realize that they were low in blood, and the only symptom they had, very pale and usually fatigue, you know, short of breath or fatigued, or you hear a swishing sound, you know, just like your blood's trying to try and make up for its lack of oxygen.
Now,
and
let me ask you a question, Dad, quickly, because we get a lot about this as well. People will talk about bariatric surgery, and there's a lot of anemia after that as well, right?
Yeah.
So when somebody has like a bariatric surgery, they're definitely gonna, you know, probably for the rest of their life need a B12. We'll need to make sure they're getting enough iron, and they're definitely gonna need digestive enzymes. They'll generally have an issue with hydrochloric acid, not enough as well, but so they'll be way more prone for things like candida and all those things, right? But so if somebody is anemic because of a bariatric surgery, then you're going to have to supplement. Absolutely.
Yeah, and the blood boost is the best because blood boost has everything in it, and it's in a liquid chelated form. Like if you look at all those vitamins and minerals that are in there, they're all chelated. They're already broken down, and you know, especially someone with bariatric surgery, they at the best of times, they have trouble absorbing anything. And so this is just rapid absorption, and I would have them on our sublingual B12 100% for sure.
Yeah. Okay. All right, Brandy, what's up next?
Rosa would like to know if you can discuss quickly sleep apnea.
Yeah. So again, sleep apnea, I feel is often labeled as a cause when it's really an effect. Sleep apnea, usually for probably the 80-20 rule, has to do with an insulin resistance problem in people. So if you look at sleep apnea, a lot of people get rid of sleep apnea machines when they fix their insulin resistance and when they fix their metabolic health. Again, I don't know how many people we've had come through Martin Clinic, been involved with us online, that have completely gone off sleep apnea machines and corrected that issue because they were insulin resistance. In fact, I'm confident enough to say that probably 99% plus people with sleep apnea, it's because they've got insulin resistance.
Yeah.
So that's where I would definitely, absolutely 100% start, is fixing insulin.
Yeah, and you know, there was a study came out. I think we did a live. This was, you know, several months ago. But I talked about the study. It was kind of funny. You know, they said, well, when you have sleep apnea, you have a very fat tongue.
Yeah, that was interesting. I saw that.
You know, it was interesting, right? And then they were saying, like, that's why you need a machine, you know, to get the oxygen. They put the oxygen up to your brain, your tongue, when you're sleeping. But isn't it interesting that once you lower your insulin, your tongue shrinks? I thought it was if you stop talking, but no, it's if you really watch your insulin, it helps to shrink your tongue. This is what they've shown. This is not my studies, but like Junior was saying, we have seen multitudes of people where their sleep apnea is gone when they lower their carbohydrates and lower their, thus lowering their insulin. So
Yeah.
insulin is a huge factor there.
Now, what other nutrients now would you talk about for sleep apnea? Like
Well,
if
B12.
somebody- B12 for sure. That's
They're
a big
always
one.
low in B12.
Yeah.
Remember, oxygen to the brain is B12, right?
And then
vitamin D.
Yeah.
Vitamin D.
Yeah.
Well, it's for everything.
Yeah.
But vitamin D, those are things. Magnesium sometimes is they're deficient in magnesium. So yeah, those are the ones that I see. I love Navital because the pine bark crosses the blood-brain barrier. It's an oxygenator. It elevates your nitric oxide. Nitric oxide just sort of opens your blood vessels. So those are the things that, in terms of supplements, and then if you lower your inflammation, of course, our curcumin, we love that.
DHA is good for that as well.
DHA oil, all of those things lower inflammation, and insulin elevates your inflammation of your tongue too.
Yeah. And there are other causes of sleep apnea. For some people, like a real bad gut can cause it, because if you get an overload of stuff like candida, or you get real sinus issues. So there are other causes as well. But for most people that we come into contact with, it's definitely an insulin problem. All right, Brandy, what's up next?
Sheila would like to know if there are any benefits to apple cider vinegar.
Yeah, I think, well, I mean, vinegar is very good for you, first of all. I mean, there's no question that vinegar is very, very good for you. And apple cider vinegar is also very good for you. But like anything else that first comes out, I mean, people have been using vinegar for a long time. You look at history, it's been used to treat a lot of stuff. Apple cider vinegar can be very good for heartburn. It can be very good for a lot of things. The problem is when stuff first comes out, it gets this almost superhero halo effect around it, where people are using it for absolutely everything, and their aunts, uncles, brothers, sisters, nephew, cured this from something. And apple cider vinegar kind of went through that, where for a while there was nothing that apple cider vinegar couldn't fix or do, which obviously that's not the case. But yeah, apple cider vinegar is very good. It's great for digestion. It's great for heartburn. It's again, vinegar is so good for you, right? So we like apple cider vinegar. Well, nobody likes taking apple cider vinegar. So when we say we like it, we don't like the taste of it because it's terrible. It's brutal. I mean, you could do it every day for 100 days and it's still bad. It's terrible. But
I like balsamic.
Yeah, so I mean, vinegars are good. Apple cider, like I said, at the end of the day, it is very good for you. You got to cut away some of the hype around it, but it's definitely effective. Yeah. All right, Brandy, what's up next?
Grace would like to know if our Navital is good for rheumatoid arthritis.
Yeah, definitely. It is for a few reasons. One is that pine bark controls the master switch for inflammation, so it's very, very good at reducing inflammation. Pine bark also helps make your immune system better identify its own tissue, so it helps with autoimmune issues that way. But yeah, promotes blood flow to the joints, improves nitric oxide, which again promotes blood flow to the joints. Yeah, very good. In fact, there are a lot of people who take Navital pine bark for joint pain, even rheumatoid arthritis. And Dad, you speak to this. You've been doing this for a long time.
Yeah, and one thing too, when we first discovered pine bark, it's not only like inflammation, absolutely, but energy.
Yeah.
And so, most people, obviously, with rheumatoid arthritis, autoimmune disorder, their energy is in the tank most of the time. And, Navital does twofold, because it not only lowers your inflammation, but it will give you more energy. So when we first discovered pine bark extract, I mean, we're going back a long time now. The first thing that it did that we noticed was that it crossed the blood-brain barrier. It just gave you more oxygen, gave you more energy.
Felt better.
So,
yeah. Yeah. But yeah, for sure. I mean, I would also, for rheumatoid arthritis, I would definitely take a look at the gut, because the gut plays a massive role in autoimmune disorders. So I would definitely be taking probiotics. I would fix the gut. I would identify any kind of food sensitivity, avoid those foods that makes it worse. Because you got to remember, autoimmune, the body's turning on itself, and it, sometimes it turns on the joints, you end up with rheumatoid. Sometimes it turns on the thyroid, you get Hashimoto's. But the root cause can be very same for a lot of people. It just shows up differently. So I would identify, again, the cause. The effect is rheumatoid. What's the cause of what's making it irritate, what's making it worse. And a lot of times it's just switching a few foods out, fixing the gut, and then stuff like Navital, curcumin, DHA, probiotics, all great for joint health. That's the route I would go down. All right, Brandy.
Erna would like to know, how long does it take to clear candida from the gut?
That's the $1 million question, isn't it? It depends. I mean, again, it's our favorite answer. It depends. We can have a whole radio show saying it depends. It wouldn't get any listens, but it depends. Again, how bad is it?
Sponsored by Depends Diaper.
Yeah,
no, Depends, right. Not diaper. What are they called?
Yeah, it's one of those things that, again, why is it there in the first place? Typically, it's a bad digestive system. Typically, the acid in the stomach, the gallbladder, everything that's supposed to be stopping the bacteria from, or the candida to get into the gut and then multiply, is not doing its job. And then it crosses the blood-brain barrier, crosses the barrier in the gut into the blood. And then it can cross the blood-brain barrier, because they've shown that candida, and we had a video on this where candida can actually get into people's brains. So the only way it can get into the brains or the blood is if it gets into your digestive system. And so that's first and foremost. How long has it been there for? The longer somebody's been having problems with the candida, it's going to take some time to kill it off, because they're stubborn. They could take a while. Food feeds it, right? Certain types of food feed it. It craves certain things, and we tend to give it to it a lot. Dad, you'd answer this because you've seen so much of this in the clinic.
Yeah. Well, and the thing is, I always tell people that, it depends. You're right. And you know what? You're better off to be on the safe side, because one thing about candida, yeast, fungus, it loves moisture. So once it gets into the body, it can land in your lungs, it can land in your sinuses, it can land on your skin. A lot of eczema, psoriasis is fungal based. So as Doc Jr. was just saying about getting into the brain, what they showed about candida, by the way, is that when they were doing autopsies on people with Parkinson's,
yeah,
that was one of the most common denominators, that the amount of candida yeast that was found in the brain of Parkinson's disease. So again, all I'm saying is, like, especially ladies, you understand yeast. Like, men don't understand yeast very much, but women do. Think of a yeast infection. Well, why does that happen? Moisture. And a lot of times with the bladder, it's yeast. It's not bacterial, it's yeast. So you take an antibiotic because you got a yeast, you have a burning, and I don't blame you. You want to take an antibiotic. The problem is that when you're killing your good bacteria, you're setting yourself up for recurring, not only yeast infections, but also reoccurring bladder. And that's what happened oftentimes in the sinuses. You get one sinus infection, you take an antibiotic, then you got chronic sinusitis, and it's not bacteria, it's yeast. And then you get postnasal drip, it goes down the throat. And so I just tell people, look, it might take you a year, it might take you 2 years to get rid of candida completely.
Yeah, and I would tell people that have real bad sinuses, as a FYI, is to get a little thing to measure the humidity in their room where they sleep, and they'll find out in the wintertime it's so dry that it's actually harder on the sinuses, causes a lot of postnasal drip. So a good humidifier, you can keep that humidity level between 40 and 60%. It's incredible how much that helps people at nighttime. But that was just a little side thing. All right, Brandy, what's up next?
Judy would like to know, on the reset, because you're not having any sugar, does this affect your electrolytes?
On the reset, because you're not having sugar, does it affect? No, because sugar isn't an electrolyte. And here's the thing, a lot of people that do go on a low carb or a reset type of thing do get into muscle cramping issues because they aren't consuming enough electrolytes. And the more water they drink, which helps, it can also, take that ratio of electrolytes down. So they definitely want to be salting things. There's certain ways, there's tricks around it, but it's not uncommon for somebody to go real low carb and start getting muscle cramps, and that's an indication that they're not getting enough electrolytes. They've got to up their salt. There's no question. They should be taking magnesium, a little bit of potassium, those kind of things for sure. But sugar isn't sugar. Gatorade did a good job kind of fooling with people a little bit by thinking that that's part of what you need to rehydrate. It's not. Glucose in no way is an electrolyte. Stuff like salt, magnesium, potassium, those are the things that generally will lead to low electrolytes issues. And when you're not eating, when you cut out carbs, you're cutting out some of the stuff that you usually would get for electrolytes. So you have to get them in other places.
Yeah, and the other thing is sugar actually dehydrates.
Yeah, sugar dehydrates.
So because it affects the kidneys, and you're now secreting your potassium and magnesium. You're not keeping it in your body. You're getting rid of it.
And then you're bloating up after as well.
Yeah. And usually too, and when you're low carbing, especially if you get into ketosis, you might get into cramping, but that usually is temporary. As your body adjusts to the new fuel. And, as Junior was saying, it's a good idea. One of the ways you can really salt up is to take Himalayan salt. Take the pink salt, which is a much better salt, full of potassium and magnesium and iodine and stuff like that. So the minerals are in there. So a lot of times you don't have to add electrolyte, just add a good salt, and it can make a big difference. But some people need some magnesium, which is never bad for you, or potassium. I dehydrate very quickly, by the way. That's just the way I am. Tony Jr. sweats. I don't sweat. You don't see it, but I dehydrate very quickly. I have to be extremely careful for me in the heat or when I exercise. And I usually don't feel it then. It's afterwards. And I really got to be well hydrated or I'm in trouble.
Yeah. All right, Brandy.
CJ would like to know if you can speak on fasting and how long is good enough.
Yeah. So fasting. All right. Let's talk I'll kind of go through this quickly because we get this question a lot and it's a great question. There are a few different ways people fast, but even before I get into that, the idea of fasting is very simple. There are two big reasons why people fast. The first thing is because insulin is a food hormone, meaning whenever you eat food, insulin is secreted. When you're not eating food, insulin kind of tapers off, right? So the idea is if somebody has insulin or metabolic issues, they don't eat food, insulin stays low, and then they also start to strip away at the glycogen storage in their liver and stuff like that. So it's good to clean things out that way. Now, the best way to fast really depends on what somebody's comfortable with. The most common way by far is the 16-8 method, which is people are fasting for 16 hours a day, and then they're eating for 8 hours a day. And a lot of people do very well with that. Most people, they'll skip breakfast, they'll eat around 12 or 1. They'll stop eating around 8 o'clock at night, and then they rinse and repeat, and that's a 16-8, and they feel great doing it. Some diabetics don't do as well that way. They do better eating in the morning and fasting until they eat till about 4 p.m., fast till the next morning. And some diabetics do much better that way. And it has to do with a natural reaction for a lot of people where their blood sugar levels are higher in the morning, and that's normal. Most people that way. Some, though, if you're diabetic, it's a little bit more out of control in the morning. So they tend to do better eating in the morning, but whatever. That's the most common way. Then there's the every other day fasting method, and that's effective as well. And the best way to do that is you eat supper and you fast until supper the next day. So that's a 24-hour fast, but you get to eat food every day. And some people do that once or twice a week, and they're good like that. They can they do it. And then there's more of a therapeutic fast, which is like 24 hours plus. Some people will do a couple day fast, a 3-day fast, they'll cleanse, whatever. So that's the most common way. But what's the most effective is one that you can do, right? That's always the best. Do one that you can do. Do you have to fast every day? No. If you can incorporate some fasting in, it's good to be metabolically flexible. But here's what we do know. And there's been a few studies out over the last little bit to show eating windows. There was a real interesting study that looked at the effect of fasting so they would eat 9-hour window and rather than 8. And they found that metabolically people were healthier, blood sugar levels were better, and even if they didn't lose weight. And that's one thing I want to say quickly. A lot of research shows fasting is beneficial even if the person isn't losing weight. It still helps their blood sugar levels. It still helps a whole bunch of metabolic health markers, even if somebody isn't losing weight. Because one of the things people do is they fast for weight loss. And they're like, oh, I'm not really losing weight. But research is showing that the metabolic markers are getting healthier. So that's, generally speaking, like I said, we would recommend most people that 16-8 method. Some people might fast even 18 hours and eat for 6 hours. But whatever works, we're big fans of fasting. I don't know if you want to add anything to that, Dad.
Well, I think I saw Margaret there ask the question about what about 5 days? Now you're getting into the things that I don't like. Okay, for a long period of time fasting, like not eating at all for 5 days, I don't think that's beneficial. I think I've seen a couple of studies on 3-day fast to start. You get a diagnosis of cancer, for example.
Yeah, that 3-day fast seems to be magical.
It's like a 3-day, 72-hour type of thing where they're not eating, just to start off. You can do, but I'm not so big on going past that. I think that look, one thing I know for sure is we eat too much and we eat too often.
Yeah,
that's for sure. Okay, and the key with what fasting does the most, in my opinion, is that it lowers your insulin resistance, because insulin is a food hormone. So when you're not eating, especially if you get past the 12 hours, so if you stop at 6 o'clock at night and you go to 6 o'clock in the morning, well, now you've gone 12 hours. And if you can get into the 14, 16, 18 hours, the more you get, and sometimes, like Tony Jr. said in emails, you have to work your way into that, because maybe on the first day you don't feel so good. But a lot of people find that, I feel, I can stretch it out. What that is doing is it lowers all your markers of inflammation, because you're lowering your insulin. You're lowering your insulin resistance. And one of the other studies have shown is that you turn on your autophagy, right? So what that does is you're eating up cancer cells.
Yeah, you're eating up all the junk.
All the junk in your body.
Now, one more thing I'll say after is, let me just say this real quickly. One of the reasons I'm not a big fan of the real long fast is because one of the biggest problems we have as we age already at this point is muscle loss. Muscle is harder to build as we age, and muscle loss can happen pretty quickly. So when somebody's not eating for 5 days and they're not getting enough protein, it's that risk reward, or is the benefit? I think you can get a 3-day fast and get what you need out of it rather than these really long ones. But again, some people do well on them. So, all right, Brandy, what's up next?
Ruth would like to know what some underlying reasons for rashes would be.
Yeah.
Gut.
Yeah. That's usually
if you look at your skin and you got a rash, you got something going on in your gut. One of them I just mentioned was yeast. It's fungal. It's candida. It's so often misdiagnosed because people want to put a label on psoriasis, eczema, dermatitis, acne, you name it on the skin. But the skin is directly related to your gut.
Yeah.
And this is why when we put people on probiotics, digestive enzymes and because the stomach and the gut, they work together, but your stomach is very, very acidic. And it needs to be acidic. And if you get, you know, a lot of people that don't have enough acidity in their stomach. So that's a huge issue, and they're not producing enough amylase or protease or lipase to break down food properly. That can affect your skin big time. And bacteria like H. pylori and others like that, SIBO, are small intestine ones. But the gut is so key when it comes to the skin. I've cleared up thousands of patients over the years. I mean it.
Now,
With,
a differential,
cleaning up their gut.
like a differential diagnosis would definitely be gut first and foremost for a majority. Hormones can also do it. Hormones can cause that as well. Those would be the two. They'd cover most cases, gut and hormones, and sometimes both. A lot of times gut causes hormonal issues. But like my dad said, for any kind of skin issue, I would recommend probiotics. I'd recommend digestive enzymes. I would also recommend high DHA, and Navitol is generally what we would use for that kind of stuff. And then if it's a hormonal issue, you got to address the hormonal issue as well. But those 4 things there clear up a lot of skin stuff. All right, Brandy.
Cheryl would like to know if you can discuss sweeteners and which one is best to not disrupt gut flora.
All good questions.
Yeah. So one of the problems with sweeteners, especially as they kept on inventing all these different types of sweeteners, is they're starting to look at now the effect that these things have on microbiome, which is that, you know, colony of bacteria that live in your gut that's necessary for good health. And do these sweeteners have an effect on gut bacteria? And some absolutely do, right? Some of the common commercial ones do have an effect on your good bacteria. So those are the ones we usually tell people to stay away from as much as possible. I mean, we live on planet Earth. It's pretty hard. And, you know, it brings up an interesting discussion because you hear this a lot. We get asked this question a lot. Is, you know, like, is regular pop better than sweetener pop? Like, is, you know, so it's a kind of a funny discussion because are sweeteners worse for you or are sugars worse for you? And that's a discussion for another time. But it's interesting. People want to know about sweeteners. There are a lot of good sweeteners and there are some that are bad sweeteners. A lot of the commercially heavily used sweeteners, they definitely have their issues with them. We like erythritol is a big one that we like. That's been shown to not affect good bacteria. And it's a little harder to get, but you could definitely find it. A lot of people, like, you know, Dad, I've heard you say this before. Stevia is okay, depending on the sources. You got to remember some of it's highly processed.
Yeah.
But some of the stevia is good. But some people don't like the taste of stevia, and I'm not a huge fan. To be honest with you, I don't even tolerate stevia that well. I get the weirdest digestive system.
You know, a lot of people do not tolerate even any kind of sugar alcohol.
No.
Stevia is not a sugar alcohol, but anything with OL at the end. So when you see xylitol or erythritol, mannitol. I mean, I remember there was an ice cream.
Like a bomb.
I was so excited about this ice cream because
it's like a bomb in the stomach. It's, if you want to have like gas for the next 5 days, consume that.
I remember that it was like, but it tasted so stinking good. But it only took about 5 minutes to start.
That's a bomb in the
your
stomach.
gut, and it was explosion.
You can't digest it, right? So, and I understand, like, there's all these different sweeteners. A lot of people like monk fruit. Monk fruit's good. There are a lot of good ones out there. First, can you tolerate it? Second, is there any evidence that shows it kills good bacteria? Is a big one you look at. Does it affect insulin? That's another interesting debate. People that are really, really insulin resistant, some sweeteners can cause an insulin response, which is interesting because it's a 0 calorie, but it can fool enough. So there are some interesting discussions. But again, we like to talk more 80-20 rule for people. If you can find a sweetener that isn't highly processed, that isn't like on the list of stuff that's going to cause all these issues, and you can digest it well and it's not going to kill good bacteria, then by all means, go nuts. And I understand, like, some people for coffee, for example, they got to put a sweetener in their coffee, right? So they're trying all these different ones. But yeah, I mean, it's an interesting discussion on sweeteners, but like I said, those are kind of the guidelines that we use when talking about that. And there are some.
I wouldn't overuse them. That's all I tell people.
Don't.
You know what? And it's amazing too, just on this, because especially when they're doing the reset or whatever, they want to go low carb or whatever, and they're always looking to sweeten things because you're coming off sugars.
Oh yeah,
and now you works wanna, and so it's a practical. It's a very good question.
Yeah, it is. And if a sweetener is going to make it easier for people, then sometimes that's what they got to do.
Yeah, it can be until a transition, they come off. And then
Yeah, because the metabolic health, like again, we're looking at them from a metabolic health standpoint, and sometimes they need to put sweeteners and stuff. Which that it's let's correct the underlying thing, and then let's tighten that up after. But yeah, all right, Brandy, what's up?
Mara would like to know, if you don't have a gallbladder, what should you be eating or taking for your system?
Yeah, gallbladders. It's an interesting thing because the gallbladder does a lot more than people give it credit for. And when you remove a gallbladder, and sometimes because they're so full of stones and they're so painful that essentially the gallbladder is dead, you got to take it out of there, or it's causing some issues, which is, some people have to do that, but they are going to set themselves up for more issues down the road. There's no question. Obviously the digestive issues that are going to come along with that, but also the gallbladder plays a role in protecting you from junk, right? Like candida and all those things that come through there. The gallbladder plays a role. So somebody who lost their gallbladder is going to be at a much higher risk for those kind of things. So you want to be taking digestive enzymes. There's no question. You want to, like, if somebody doesn't have a gallbladder, they need digestive enzymes. In my opinion, it's something they should get used to doing. They also, there's a lot of debate out there on what kind of foods they should be eating after. Can they eat high fat stuff? Should they eat, they can still eat low carb. They may have to cut back on fat a little bit, just because they might not tolerate that well, might not be able to digest it. But the big issue is you're going to be at a much higher risk for candida, yeast, leaky gut, those kind of stuff. And then usually a good digestive enzyme makes that part of it a lot easier. I don't know if you have anything else you want to add to that, Dad?
Yeah, well, just the fact that it's a 90-10 rule. 90% of gallbladders happen in women. It's kind of fascinating, right? And women, it's hormones. Think about the difference in a woman. If you have estrogen dominance, that can attack. One of the common symptoms of estrogen dominance is gallbladder problems.
Yep.
How do I know that? Well, because women, oftentimes after having a baby, where they lose all their progesterone in the placenta, they get a gallbladder attack within a week or 2 weeks or a month after having a baby. And that's because of progesterone, a lack of it. So that's one thing. But the other thing too, and I always say this about the gallbladder, the gallbladder is in between two things, your liver and your pancreas. And those two organs have a huge effect on the gallbladder. And so it's important to lower your insulin because that affects your gallbladder. And it's also important to lower your insulin because that affects your liver. Your liver, you get fatty liver. And the liver has a big effect on the gallbladder. So I tell people, look, you lower your insulin, you often can save your gallbladder. Amazing. And if you can lower your estrogen, you dim it out, we use the hormonal formula and that dims that estrogen down. A lot of times they're so much better and their gallbladder, but you gotta, and of course the enzymes, of course, you want to treat that. A lot of times, one of the things that I find effective just for the gallbladder is stop eating.
Yeah, fasting.
Try and stop eating about 5 o'clock.
Yeah.
I know it's not always possible, but if you can, stop eating. Give yourself like that fasting. Boy, that makes a difference on the gallbladder. It empties it out. And, and one of the things that Tony Jr. was saying, and this is so true, one of the things that your gallbladder does, it's a reservoir, it's a little pouch, and it dumps bile. You know, it emulsifies the fat, but that bile has a big factor on your pH in your gut. And so, like, you know, for bacteria, even this virus, like, you know, to get inside your body and all that, because your body is unbelievably, fearfully and wonderfully made, ready to fight all that stuff. But, you know, it's amazing. Those organs, you can live without it, but it's an important
Yeah, it's not optimal. All right, Brandy, what's up next?
Dove would like to know, if you have fungus in your body, is it okay to use a sauna?
Is it okay to use a sauna? Sure. I
mean, probably the moisture you're thinking, right?
Yeah.
The sweating. Yeah. Oh, it's so good for you.
Sauna's tremendous for cardiovascular health, tremendous for dementia, Alzheimer prevention. Honestly, saunas are one of the best preventative things people can do for overall health. Great for high blood pressure, great for cardiovascular health, great for dementia, Alzheimer's, and won't have a negative effect on candida, that's for sure. Because candida, really, to be honest, even if it's on your skin, it's an internal issue, right? It's something that goes on the inside, which is why when somebody has real bad nail fungus, they give them a pill to kill it, because it's really an internal issue. But yeah, a sauna will have, so many positive effects, and it won't have a negative effect at all on candida. All right, Brandy.
Dr. Martin Jr., we all know you can't eat eggs.
Mm-hmm.
How did you determine you couldn't eat eggs? Was it the elimination diet? And
it was.
What do you eat during the day?
So, yeah, it was painfully obvious, because when I eat an egg, I was in ridiculous amount of pain, even hospitalized early on in my 20s. I was eating scrambled eggs, and I didn't know what was going on at the time, but it didn't take too long to figure out that I can't eat eggs. They cause a lot of discomfort, a lot of pain. And so that's the thing. So I get egg envy. I always say that, because it's such a great, easy, fast source of protein, right? And I do lift weights. I do like to exercise. So getting protein, honestly, for me is not easy, because I can't digest a majority of proteins. Powdered proteins, I can't tolerate almost everyone on the market. Bone broth, I can. Some like collagen based, I can. But wheys and pea proteins and vegetable proteins and plant proteins, and I just can't. I don't do well with them at all. So I got to get protein the old-fashioned way with food. And so, like, I'll eat a fair amount of bacon after I lift weights. I got to get the old-fashioned way. I just can't have eggs. It's unfortunate. Eggs are so good for you, loaded with amino acids and all these kind of things. It's a great protein, but I can't get it. And I don't do well with cheese either. So the eggs, meat, and cheese diet doesn't cut it for me. I can't do it. And it's like, again, if I, it's so funny, right? Like,
he's weird.
Oh no, my digestive system's very weird.
But,
it's
Tony,
very eccentric, I tell people.
Yeah. And you know what? My firstborn, Tony Jr., we tell the story of what happened to.
Oh, I blame mom 100%.
100% your mother. Was not my fault.
No, the blame lies solely with my mother.
I got a personal story, because Rosie had one kidney, and they found that out. She pretty near died when she was 8 years old, and she was on antibiotics for 7 or 8 years
straight,
every day. In those days, they didn't understand the side effects. You got to understand. You go back to Rosie was born in 1951.
I don't think she'd want you to say that.
Oh, I didn't mean to say that. I was born in 1950. But when your mother was pregnant with you, Tony Jr., because of this kidney, she got a kidney infection, and she only had one. Had a kidney infection early, I think within the first month or two of her pregnancy with you. And guess what? Like antibiotics, they said you can't take a chance. If that kidney shuts down, you're not going to live. Not you, Tony, but your mom. So she was on antibiotics the rest of her pregnancy with you. Guess what? You were the firstborn, and man, oh man, your gut.
Yeah.
You know, I could write a book just about your gut.
Oh yeah, no, and I've had problems my whole life with my gut, but I mean now my gut, like I said, has been good for a fair amount of time, but I got a very restrictive.
Yep.
Yeah, and I just can't. Like I said, I always try different. Like over the years, I've always tried different. Well, maybe I can try this again, and they can't. So I
can't do it.
Now I'm 46 years old, and I've given up the ghost. I'm just not gonna eat eggs.
No, and you know what? I tell a lot of people, by the way, I would put my hands like this in the office, and I go,
yeah,
bring your diet in.
Yeah.
Like rope it in.
Yeah.
Like, you don't do well with this food.
No.
Listen to it. That's the elimination.
Yeah.
By elimination, you don't do well with that food. Stop eating it.
When I had done a digestive test, like a sensitivity test, I had the guy call me after and thought it was a mistake because it literally was, there were so many things that it just went off the chart. And I'm like, no, welcome to my digestive system. But again, I can't complain because the probiotics and the enzymes and stuff like that has done really well for me. But yes, that's where we're at. So when I talk about digestive issues, I can empathize because I've been through them big time. I've been through them. All right. Next question, Brandy. Enough about my gut.
Dr. Martin Sr., we all know you love your coffee. Is there a specific brand that you recommend?
Well, look, I'm a dark roast guy, so I'm not even going to give you a name. I love dark roast coffee. So I was a Tim Hortons guy for, 100 years. I travel.
Give or take a few years.
I remember going about 40 miles one day out of my way just to get a Tim Hortons.
I do remember that, yes.
You remember that, Tony?
Yes.
For me, but I love coffee and I love dark roast. Now, everybody's different with that. All coffee is good for you. It's what you put in it.
Yeah.
But
coffee,
the coffee's good, but if you are adding your sugars or you got to have,
but a good organic coffee, like a good organic coffee.
Yeah.
A good, source.
That's what I drink. A good,
it's sourced properly organic. Cause like I said, a lot of times these things are sprayed quite a bit. So good. Like I like coffee. I drink my fair share.
I like McDonald's coffee.
But I'm not a dark roast person either. So
I feel sorry for you. But used to.
I'm not strong enough for a dark roast.
Because when Ethan was, what do they call them over at Starbucks? The baristas, or what do they call those guys?
Yeah, barista. My son used to supervise at a Starbucks for a long time.
Yeah, well, you know what? He used to tell me how much sugar they'd put in all those coffee, cappuccinos and all this. We're not talking that. I hope people understand that, right?
All right, Brandy.
Judy would like to know, if you have thyroid issues, does the hormone support in time help with energy?
Oh yeah, because if you regulate or you get a thyroid kind of balanced out and working properly, thyroid is your gas pedal of your body, right? Your thyroid is tiny. It secretes a very little amount of thyroid hormone throughout the year, but it is the gas pedal. It does make everything operate at the right speed. So energy is a big part of thyroid function. I would say, though, that with somebody that has low thyroid, there are other things going on behind the scenes that's also causing low energy. So you want to get that thyroid functioning optimally, but there are the thyroid is, we've said this last week, but the thyroid's a puppet. There are other things as well. A lot of times, if you watch the video that we did on thyroid on our website, you'll see that the thyroid often is attacked by other things. And here's the thing. Most people that have thyroid symptoms, they have normal blood testing. It's such a common thing. They have every symptom in the book. They go to their doctor and the doctor does the blood testing and the doctor comes back and says, hey, everything's normal. And then the person's left wondering, how could it be normal? I got every symptom in the book. And that's a very common issue for thyroid. And we have a video on why that is. There's a few big reasons for that, but that happens for a lot of people. And the reason is they're getting thyroid symptoms because it's a thyroid distress. The thyroid's like a little beacon. It's letting it know that there's something going on, and there is stuff going on behind the scenes. So if somebody has a true thyroid issue where they are low in the testing, they go on Synthroid and they feel better, that's great. But a lot of people have thyroid problems. If it shows up normal, or even if it shows up low, they go on Synthroid and they don't feel any better, or they get the blood test and everything's normal, then they got thyroid distress syndrome. There's something else going on around there. You want to fix the thyroid and address whatever else is causing that thyroid issue. So thyroid's very complex, which is why, in our opinion, it's mishandled so often, because there's so much going on behind the scenes for thyroid. All right, Brandy. So we got about 8 minutes left. So we'll just try to rapid fire here if you can.
Bev would like to know if there's anything you need to do to prepare for the reset.
Pray? No.
Well, you know what I say about the reset? It's simple, but it's not easy.
Yeah.
Because it is drastic.
Yeah.
In the sense that, you almost have to, it's like heaven, right? It's like heaven. You hear a lot about it and it sounds wonderful, but until you get there, you really can't, 100% know what it's like. And the reset is like that. I mean, it's once people do it and they get into the first week. So you got to be determined, like, to get ready. You just got to understand that, it's going to be suck it up buttercup for a couple of days. It's not,
because a lot of people, we like the questions. People are saying, what can I eat on the reset?
Eggs, meat, and cheese.
And then they're like, okay, so what else can I eat? And we're like, the eggs, meat, and cheese. Well,
and
what
I
do you have with
explain
the
it.
eggs, meat, and
Actually,
cheese?
I explain it. And in the new book that we're writing right now, I explain why those three foods and not others.
Yeah.
There's a reason for it. Temporarily. It's a temporary fix, right?
Yeah. But it is, to get ready for it, you have to be prepared for cravings. You have to be you have to mentally prepare, especially if you're metabolically broken. You have to prepare. The body is going to fight hard against it at first, but once you get through it, everybody says, most people will say, listen, after so many days, I'm no longer hungry. I'm worried I'm not eating enough, that kind of stuff. But yeah, so that'd be my advice beforehand. All right, Brandy.
Is there anything wrong with using a barbecue?
I hope not. Listen, I mean, again, there is something to be said about not eating burnt food, because there is a chemical reaction that takes place there. Again, people will debate about smokers. There are the big smokers that people use. Is there an effect of the chemicals on the food? You got to look at the big picture first, right? If somebody is used to eating junk all the time and they get to eating more whole foods and they barbecue them or smoke them, that's still better than what they were doing before.
100%.
You can always tighten in after. Yeah. There's no question. The smoke from the food from a smoker is not going to kill them nearly at the same rate as a typical Western diet will, right? I mean, we can get kind of bogged down by weird things sometimes. But yeah, listen, again, just don't burn your, just don't eat burnt food. I mean, like I said, I know I go to my dad's house for a barbecue a lot. I mean, we barbecue. I mean, so for us to say there's something wrong with it, I can't see what the issue would be. But
eat your steak, vitamin S.
Yeah, and just don't burn your food. I mean, honestly, that would be the one thing that we would tell people that not to do is eat the burnt stuff.
Don't overcook it.
Yeah. All right, Brandy.
Why do some people get flu-like symptoms while on the reset?
Yeah, that's keto flu. That's the same. I mean, that again, the body, you're going to hit a certain point where your energy is going to fall off the table. You're going to get to a certain point where you may get headaches. You get a keto-like flu thing. And there are a few reasons for that. Some could be as simple as not getting enough water and electrolytes. Other people may not be eating enough. But it's when you switch from burning carbs to burning fat, and you become fat adapted, they call it, or keto adapted, and that could take a little bit of time, you can go through a keto flu-like thing. So that definitely happens. And again, it's like anything else. The body's detoxifying all your mental cravings, everything. But yeah, when you switch over to ketones for fuel, the body can have flu-like symptoms, and that does happen. All right, Brandy.
Why do our probiotics not need to be refrigerated?
Soil-based. So they're soil-based probiotics. That's why they don't need to be refrigerated for that reason. They're resilient. Most probiotics, if they need to be refrigerated, they lose about 25% every month of their content, just through that's how it works. Soil-based ones are definitely more resilient, which is one of the reasons why we use them. We built our formula first and foremost, and then we went and got the kind that we like that gets through a little bit more pH resistant as well, right? They get through the acid a lot better. So there's a few reasons that went into that, but that's why. Yeah.
And a very good broad spectrum. And the email that went out today about probiotics and why we chose certain, the formula we did, really, you really see the advantage of that probiotic.
All right, Brandy.
Soil-based, you can't kill them. You can take them on holidays with you. Can't take dairy-based ones because you lose. If you keep put it in room temperature, you lose all the effectiveness of the bacteria. They die.
All right, so we'll do one more question, and then you're keeping track of the questions, Brandy. You can give them to my dad to answer tomorrow during his Q&A.
Yeah.
And again, we're going to do this more often. We're going to do this again next week because we have a lot of fun doing this. The questions are great, and there's so many questions, and I know we can't get to them all. And we really like the fact that you guys are spending time with us here. So, all right, Brandy, one more question just to make it a good one.
While you're on the reset, do you continue with your supplements?
Yes.
Yes, for sure. Yeah.
Yeah. Absolutely.
So that's it, Brandy. That's okay. All right. So again, guys, listen, we had a lot of fun doing this. We're going to do this again next week, especially that we're still in lockdown mode for who knows how long. So we're going to do this again next week. We're going to put a recording of this on the website. We'll send this out next week in an email, and we're going to actually have them. We're going to have a drop-down menu on our website where you can access these Q&As to make it easy for people. And again, hey, listen, thanks everybody for joining us. We had a fun time. Have a great day, and we'll talk to you guys later. Thanks.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.